Now, it has been 2 years since the coronavirus pandemic started. During this time, there have been multiple waves, millions of lives were lost. And right when the world had accepted coexisting with COVID-19, the virus came back in a form more transmissible than ever. Globally, a total of 6.55 million COVID cases were detected between 22nd and 28th of December. This is the highest figure since the World Health Organization declared it a pandemic back in March 2020. Almost 900,000 cases detected on average each day during this period. The World Health Organization has called the global surge a tsunami of cases from both Omicron and the Delta variants. One strong enough to push the healthcare system to the brink of collapse.
Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths. I'm highly concerned that Omicron, being more transmissible, circulating at the same time as Delta, is leading to a tsunami of cases. This is and will continue to put immense pressure on exhausted health workers and health systems on the brink of collapse, and again distributing lives and livelihoods.
Now, between 22nd and 28th of December, global Omicron cases rose up by 37%. It is driving infection surges across countries, with many reporting record daily spike almost every day. Let's start with the United States here. According to Johns Hopkins University, the United States has reached its highest ever average of new COVID cases. The moving 7-day average of new cases was over 265,000 as of Tuesday, surpassing the previous peak of 251,989 set in mid-January 2021. Though the rate of severe outcomes appears to be lower, Omicron is already overwhelming previously stretched hospital systems throughout the country and affecting a greater number of children.
We're seeing many more children infected at this point and being admitted to hospitals. We're seeing record numbers of admissions of all children of all ages, from newborns all the way through 21 years of age in hospitals and in ICUs with Omicron. Not to say that it's more severe, but it's, my experience so far is that it's not less severe, at least in kids.
Now, correspondent Susan Tehrani has sent us this report from New York. Listen in.
The East Coast, Washington, D.C., Virginia, and Maryland seem to be the hotspots for the Omicron variant. New York is also seeing a rise in cases, also a lot of challenges with testing. Long lines continue. Testing seems to continue to be a challenge, despite the fact that President Biden has vowed to get those tests in the hands of Americans. That's going to be sometime in January. The CDC, the Center for Disease Control, announced that it wants a quarantine time for individuals that are asymptomatic and infected to go from 10 days to 5 days. That has been met with some optimism and some backlash from officials. And President Biden also has said that he does not want to take the path to lockdowns, instead continuing to urge Americans to be vaccinated, boosted, and also get tested. Again, you know, the testing being the main challenge here, at least in New York and on the East Coast.
Now, the surge is currently worst in Europe. The rise in infections has forced governments to walk in a tightrope between reimposing restrictions designed to stop hospitals from becoming overwhelmed and the need to keep economies and societies open. Now, France is also reporting a tidal wave of COVID infections. According to the French health minister, over 200,000 new cases were reported in the last 24 hours. France and Europe's highest ever daily tally. The French minister, Olivier Véran, warned that France could reach more than 250,000 daily COVID cases by the beginning of January.
Les chiffres qui seront publiés ce soir par Santé publique France montrent l'augmentation continuelle du nombre de contaminations dans notre pays. Ce sont des chiffres qui donnent le vertige. Il y a 208 000 Français qui ont été diagnostiqués positifs au Covid au cours des 24 dernières heures. J'ai fait un rapide calcul avant de vous rejoindre. Ça veut dire que 24 heures sur 24, jour et nuit, toutes les secondes dans notre pays, plus de 2 Français sont diagnostiqués positifs au coronavirus.
Now, while in UK, Prime Minister Boris Johnson has said that around 90% of COVID ICU admissions are the people who haven't had their booster shot yet, Britain is currently reporting record COVID infections. On Tuesday, the UK reported nearly 130,000 new COVID cases, its highest ever daily tally. And even the virus spreading at a rapid pace, UK Prime Minister stood by his decision not to clamp down on festivities. He's rather asked people to get vaccinated and enjoy sensibly.
And I'm sorry to say this, but the overwhelming majority of people who are currently ending up in intensive care in our hospitals are people who are not boosted. I've talked to doctors who say the numbers are running up to 90% of people in intensive care who are not boosted. If you're not vaccinated, you're 8 times more likely to get into hospital altogether. So it's a great thing to do. It's very, very important. Get boosted for yourself and enjoy New Year sensibly and cautiously.
And earlier we were joined by a professor of public health at the Imperial College London, Azim Majid. Let's listen in.
A global increase in cases of Omicron. So we've seen record numbers of cases in countries like the UK, France, Denmark in recent days. I think we can expect these high levels to continue for some time, probably for several weeks, if not even months. So unfortunately, I think many countries globally will face a very high level of cases of COVID-19 in the coming weeks and perhaps even the coming months. So this is something we're going to have to try to manage as best we can. So in the UK, we're quite fortunate that we have good data coming through from our National Health Service. So the data we've got shows that the disease illness is less severe for individual patients than previous disease caused by, for example, the Delta variant. So it's about half as likely to cause hospital admission, perhaps even more than half, even less than half as likely. So it is less serious for individuals. But the problem we've got is because of the sheer number of cases, even though it's less serious for a person, at a population or country level, we'll see many people who are seriously unwell just because of the very large number of people who have got the infection. Currently, it's quite difficult to tell apart a cold from COVID infection. So when COVID first came, the symptoms were problems like a high temperature, continuous cough, or loss or change in the sense of smell. But because so many people now have been vaccinated or have a previous infection, that tends to modify the symptoms somewhat. So often the symptoms are things like headache, sore throat, mild cough, feeling tired, a runny nose, which can also occur with a cold as well, or with mild flu. So the only way to really tell if you've got COVID-19 is to get a test because of the high level of immunity we've got in the population, the symptoms are not the same as they were 18 months ago, and so you need a test really to see if you have the infection.
WION is now available in your country. Download the app now. Get all the news on the move.